think it's working.
You see the little red thing?
Yeah.
Okay. Hi, I'm here with John today, and we're here to talk about his experience with the quantum neurology. John has a very interesting case that he's going to tell you a little bit about. So maybe, John, you could start by just telling him, before we started treating you with the quantum neurology, a little bit about your history and what kind of problems you were having.
2005, I was diagnosed with nasal pharynx cancer at NYU Cancer Center. I ended up ultimately getting treated at Sloan Kettering for the pharynx cancer, which was consisted of 90 days of radiation treatment every day, actually 5 days a week, uninterrupted, and once a month cisplatin chemo was administered, and then after the 90 days of radiation, I was on 6 months of cisplatin. I would do a 72-hour injection, and then they would send me home for 3 weeks, and then the 4th week I would come back, and the process started all over again. That went on for 6 months, and since then, some problems occurred with my saliva, my tinnitus, echoing in the ear. Eustachius tube was incapacitated with the radiation. Ultimately, my thyroid gland was affected.
Nothing wrong with your tongue.
And then eventually, about 5 years after, but actually 6 years after the radiation treatment and chemo treatment, my tongue swelled up. The left side of my tongue swelled up, and I lost my saliva and my ability to swallow correctly, and the use of my tongue, actually. So I went back to Sloan Kettering to see what had happened. They thought my tumor might have possibly came back. We did an MRI. That was definitely not the case, but they identified that my 12th cranial nerve was damaged from the radiation treatment, which was 7 years ago. And they basically told me that Western medicine does not have an answer for my problem. So Kirby, who was my doctor for several years now, addressed the issue with quantum neurology, which I never heard of, and the results were basically immediate. After one session with Dr. Hochner, my sense of my feelings in my left side of my tongue came back. My ability to use my tongue came back. The inflammation went down gradually, but eventually went down. And my saliva came back. And I had a problem basically with the left side of my face as well. With that problem with the 12th cranial nerve, because I would drool. That stopped. So. And I guess it was, how many sessions did I come? 2 or 3?
Well, I got like 90% better after the first
yeah,
session.
and then we did tune-ups after that. And basically it's back to normal right now. And I do periodic tune-ups with the light procedure and the quantum neurology. And now we're moving into addressing, which was definitely a cause of radiation treatment, the numbness on the side of my face, which occurs constantly, and that actually is feeling a lot better as well. So we're getting positive results.
So basically today, for the first time, we addressed he had a trigeminal nerve problem with the sensation to the left side of the cheek and the jaw and the ear, and also some sensory loss in the cervical spine. So we did the sensory protocol on that for the first time today with complete resolution of those symptoms. He's also, what he didn't mention until today, a little bit of a taste problem. So we found he had a little bit of problem with the salt receptors in the tongue, which we treated. A little bit still of dryness in the mouth, the salivation. So we did a little bit of work with a parasympathetic supply to the salivary glands today, to the 7th cranial nerve. He also forgot to mention too that at the beginning he was having some back pain and some knee pain, which we also worked on with the quantum neurology, but that really hasn't been an issue, lately. He's pretty asymptomatic there. So really, the point of this, and the reason I had John come here to talk to you about this, is that many people are diagnosed by their neurologist or their doctor or their radiologist, and they're told you're going to have to learn to live with this for the rest of your life, especially if you've had the problem for more than 6 years. The Western medicine has no answers. Well, the fact of the matter is, with quantum neurology, no matter how long you've had the problem, no matter what the cause of the problem was, there's often a good chance, even after many, many years, that can be rehabilitated. And it's always worth a try doing. And my experience and many other quantum neurologists' experience has been that in the majority of these cases, the results are extremely pleasing and satisfactory. Just like, John has experienced in this case, he said he has complete movement. Now, his hypoglossal nerve is checking completely normal today, every single direction. He has no lack of motion. The swelling of his tongue is essentially gone. His salivation is almost back to normal. He's no longer drooling. We expect the numbness in his neck and face to completely go away, and his taste to be restored. These are the kind of things you can't fix, with traditional medicine. So it's been a great case where we've got a few minor things we're still working with, but we expect John to get back to 100%.
Yeah, definitely feeling a lot better and definitely seeing results. Very happy.
By the way, at the beginning, John didn't mention this, but he used to be a Wall Street broker, and he was forced to retire because of the sensitivity in his ears to all the noises, on Wall Street, and he had to give up that profession and start a whole another profession, which I think he's doing well in now, right?
Yeah, it's coming along.
But it was a big change in his life. He went through a lot of changes in his life around that time.
Yeah.
So I'm happy to see him, getting the quality of his life back. So thank you so much for coming today and sharing with everybody.
Well, thanks, Doc. You're a miracle worker.
Thank you. Thank you, Dr. George.